Urinary tract infection (UTI) is an infection of any part of the urinary system, which includes the urethra, bladder, or kidney. It occurs when microbes, mainly bacteria, invade the urinary tract from the skin or rectum and make their way to the urethra, bladder, or kidney. The urethra and bladder make up the lower urinary tract, and the kidneys and ureter make up the upper urinary tract. UTI have different names depending on which part is infected. A urethra infection is known as urethritis. A bladder infection is called cystitis, and kidney infection is called pyelonephritis. So now let's look at what causes UTI and how does it develop. UTI typically occur when bacteria enter the urinary tract through the urethra and begin to spread in the bladder. The bacteria that commonly cause UTIs are commensal of the perineum or lower intestines. Most of these bacteria originate from the gut and reach the urinary tract by progressive colonization via the perineal region. Did you know that in 90% of UTIs, E. coli are the culprit? Because E. coli normally lives harmlessly in the human intestinal tract. But it can cause serious infections if it gets into the urinary tract. The rest of the 10% accounts for all other bacteria, such as coliform. These coliforms include 1. Klebsiella pneumoniae, 2. Proteus mirabilis, 3. Enterobacter, and 4. Citrobacter. Other gram-positive organisms can also cause UTI. Such organisms include Staphylococcus aureus, group B strep, also known as Streptococcus agalactiae, and Enterococcus species. Now let's look at how bacteria such as E. coli infect the urinary tract system. First, remember it is bacteria contamination which is coming from anus. So, when the bacteria enter the urethra, it initializes the colonization of the urethra and bladder. This triggers an inflammatory response in the lower urinary tract. Our body's defense system, immune system, is designed to keep these bacteria at bay, so neutrophils are recruited to this area. But sometimes, the bacteria multiply in large number, causing the immune system to be overwhelmed. Therefore, bacteria at this point evade the immune system. It is also important to note certain bacteria, such as E. coli, have virulence factors such as adhesive fimbriae. These virulence factors are essential in enabling the bacteria to colonize the urinary tract and survive, despite the effectively functioning host defense mechanism. Other virulence factors are the flagellas that enable bacteria to swim along the urinary tract, including upstream from the bladder to the kidneys. These bacteria can also form biofilms, clusters of bacteria that are attached to a surface and/or to each other. When this happens, it allows them to have a safe haven to multiply and travel further up to colonize the kidneys, causing upper urinary tract infections. From here, if the infection is left untreated, it can enter blood circulations via the renal veins and, in the worst-case scenario, can cause urosepsis. What are the symptoms of UTI? The symptoms of UTI may include 1. A strong urge to urinate that doesn't go away. 2. Urinating often and passing small amounts of urine. 3. Pain or a burning sensation when peeing, dysuria. 4. Urine that looks cloudy or turbid. 5. A burning feeling when urinating. 6. Strong-smelling urine. 7. Pelvic pain, in women, especially in the center of the pelvis and around the area of the pubic bone. What are the risk factors of UTI? Women are at higher risk of UTI than men. So, let's check why women get UTIs more frequently than men. This is the question women ask all the time. Here is the reason. It boils down to basic anatomy. Women are at a higher risk of UTI because of the female anatomy. Their urethra is close to the anus. And also, the urethra morphologically is shorter than men's. So, bacteria don't have to travel very far to reach and infect a woman's bladder. This all makes it easier for bacteria around the anus to enter the urethra and travel to the bladder. The urethra is an exit for urine, and it is also an entrance for bacteria to enter the urinary tract. Other UTI risks may include 1. Pregnancy. During pregnancy, the body increases the production of a hormone called progesterone, which relaxes the ureter and bladder muscles. As a result, urine may stay in the bladder too long. This increases your risk of developing a urinary tract infection. 2. Previous UTI. 3. Changes in bacterial flora. 4. Age above 50. 5. History of diabetes. 6. Sexual intercourse may introduce bacteria, so it's important to wash yourself and urinate after. 7. Hygiene habits. Cleaning girls/baby from front to back is important, otherwise you will introduce contamination to urethra. And last, number 8, urinary catheter. Diagnosis. Your doctor will ask for urine sample to check if you have UTI. A urinalysis, also known as a urine test, is a test that examines the visual, chemical, and microscopic aspects of your urine, pee. This test can be performed at your local surgery to check if you have infection. When urinalysis is performed, your GP will check for nitrite. A positive nitrite test result can indicate you have a urinary tract infection, UTI. However, not all bacteria are capable of converting nitrate. So other markers he will look for is leukocyte esterase urine test. Leukocyte esterase is an enzyme that's present in most white blood cells. When this test is positive, it may indicate that there's inflammation in your urinary tract or kidneys. The most common cause for high white blood cells in urine is a bacterial urinary tract infection, UTI. Second test your GP can request is urinary microscopy. A high WBC indicates infection. Third is urine culture. Your GP will ask you to produce urine specimen, which can be sent to microbiology. When your urine is cultured, bacterial growth can be detected from the agar, and this will be a confirmation that you have UTI. Urine culture helps your GP to determine which bacteria is the cause of your UTI. Also, it will help to provide treatment therapy that will work for you. Because some bacteria are sensitive and can be cured easily, and other may need different treatment if they are resistant to certain antibiotic. Treatment of UTI. Treatment of UTI will depend if it is complicated or uncomplicated. Uncomplicated UTI means the renal function are normal, and the UTI is caused by typical pathogens with a normal urinary tract and kidney function, and no predisposing comorbidities. Complicated UTI means any UTI which has increased likelihood of complications such as persistent infection, treatment failure, or recurrent infection. For uncomplicated lower UTI, the first-line treatment options are oral antibiotics such as nitrofurantoin, trimethoprim, or amoxicillin, 3 to 7 days course. For complicated UTI, the patient will need IV, and you will need to be treated in a hospital. Your doctor will prescribe a higher dose of antibiotics, especially if your UTI is severe or the infection is in your kidneys. Your doctor might also refer you to a urologist. This is the end of the video. I hope you enjoyed and learned one or two things. Please subscribe to my channel, as I will be uploading more videos on different health topics. Next topics are gastroenteritis, an infection of the intestinal tract which causes watery diarrhea, abdominal cramps, and vomiting. And second topic is going to be what are the trans fats and why are they so bad for your health? These are oils we use every day such as canola, sunflower, and corn oils. Thank you again, and see you next time.